Hi, I'm Katelyn Wahl, and this is my pediatric interview project. I have with me Julie and David. David is 3 years old. He's a Caucasian male. Julie is a very reliable source of information and a good historian. So, Julie, what brings you in here with David today?
Just a well visit.
Okay. So I'm just going to ask you a few questions about David's history, mainly the birthing process and things like that.
For just a little bit. Okay.
So, okay. How old were you whenever you delivered him?
I was 29.
Okay. And you have 2 kids?
Yeah.
Understand? Okay. Yeah.
That's
totally. Yeah.
Okay.
You can go play.
He's my firstborn.
Okay. Gotcha. So she's a gravid 2, para 2. Did she have any complications during his pregnancy? Diabetes, preeclampsia, anything like that? No. Okay. Any exposures during pregnancy, like smoking, medications, might not have been good to take? Okay. What type of delivery was he?
Vaginal.
Okay. All right. What was his gestational age?
He was born the day after his due date, so 40 weeks one day.
Okay, perfect. Did you have any complications during the labor or birthing process? It was pretty straightforward.
Yeah.
Okay. Do you happen to remember his birth weight and
6
length?
pounds, 14 ounces,
Okay.
and 19 3/4
Okay. Do you remember his head circumference by chance? It's okay if you don't. Do you remember his APGAR scores at 1 minute and 5 minutes?
I think, is it on a scale of 10, right?
I think it's a scale of 5 for APGAR.
So it was like 5.
Okay.
4.5, 5, yeah.
Okay, good. But he was pretty normal.
He was healthy, yep.
Good. Whenever he was a baby, did he have pretty normal temperament? He wasn't overly fussy?
Yeah, no,
anything
he was
like
like
that?
a baby.
Okay. Did you breastfeed?
Mm-hmm.
Okay. Till what age did you breastfeed usually?
I was feeding him just a little, like morning and night until about 14 months.
Okay. All right. Was he like jaundiced whenever he was born?
He was actually.
Oh, really?
He was jaundiced. We had to do they sent us home with that Billy blanket.
Okay.
So he was our little glowworm
for
the first week. Yeah.
Okay, and after the first week it faded.
Yeah,
it
was just like 3 or 4 days. So
Okay.
we had to keep him plugged in.
Okay, good. I'm just going to ask you about some of his developmental milestones, see if you have any concerns related to that, okay? So do you remember approximately what day or what age he started to kind of sit independently? Do you remember like how many months he was?
I think maybe about 7 months. He was really solid when he was sitting up.
Okay.
Yeah.
What about crawling and taking his first steps? Hi, David.
He started crawling, so probably about maybe 7 months as well.
Okay.
Yeah, his sitting up seemed to take a little bit longer than his actual moving around.
Mm-hmm.
And then he was jogging at 11 and a half.
Oh, wow.
Yeah. He kind of went from crawling and standing to jogging.
Yeah, so he was a little bit ahead of the curve.
Yeah,
it actually sounds like.
Yeah, he's always been pretty athletic.
Yeah. When was he like saying his first words about?
Probably around a year.
Okay.
Yeah.
It was
ball. I mean, he said mama, but ball was his first. Yeah.
Okay. Was it pretty shortly after that he was able to kind of speak in full sentences? At least like simple ones after that?
I don't know. It took a while. He's a guy.
Yeah.
So maybe like 18 months. I don't know. He was definitely speaking, but full sentence. It's hard because he's 3 now, so he's obviously talking. Yeah.
Mm-hmm.
But
okay.
There was never any concern about.
Yeah, about his speech.
Yeah.
Okay.
Yeah.
That's good. Do you remember like when he was potty trained? Like how old
potty
he
trained
was?
at like a little over 2.5 years actually.
Okay.
Yeah, and he's
Good for
even
him.
dry at night now at 3.
Yeah.
So,
Oh wow. Yeah, he is doing very
Yeah.
well. It sounds like. So you have no concerns about that?
No.
whatsoever.
Yeah.
Okay.
We tried to potty train him, and it was obvious it wasn't ready. It kind of turned into a battle, and so I just waited a couple more months, and then
Okay.
he kind of potty trained in 2 days.
Wow.
So, I know. I was lucky.
Yeah. Okay. Has he ever had to be hospitalized? He hasn't had to have any surgeries or never been admitted yet or anything like that. Okay. Good. So I'm just going to ask you like some health maintenance questions, just basic ways that you've kind of kept up with his health maintenance for his first 3 years. So is he all up to date with his immunizations?
Yeah, he is.
Okay. So you got like the tetanus and all that stuff when he was a baby?
Yeah.
Okay.
I mean, the pediatrician we see was adamant that like we couldn't see her unless he was followed all of the recommended guidelines.
Okay.
So
yeah, you didn't have much of a choice. So.
Yeah.
Does he have any allergies? that you know
not that
of?
we know of.
Okay.
Yeah.
None that have shown up so far. Good. He doesn't have to take any medications.
No, I give him a multivitamin, but
just a kid's one. Okay. Good. Does he have to go to the dentist yet? I'm not sure what their
I should
recommendations
probably
are.
schedule that. Yeah.
Okay.
I think it's around 3.
Okay.
So we brush his teeth at night with an electric toothbrush.
Mm-hmm.
So he's
Okay.
But yeah.
Gotcha. He had like the normal vision and hearing screenings as a kid and everything too. Okay, good. Do you have any concerns about lead exposure or anything like that?
No, we got him tested actually. They did blood work and nobody ever notified us that there was a problem. So
okay, that's good. That's good. Do you feel like he's able to communicate his wants and his needs pretty clearly?
Yeah.
Like
especially now at 3. No, he lets me know what he wants.
Okay, so you don't think he needs speech therapy?
No
concerns with that. Okay. Absolutely not. Is his food intake on a typical day kind of what you would expect for a normal 3-year-old?
Yeah.
Yeah.
He is a good eater. So.
Okay. No concerns about him getting like not enough fluid or anything like that. He doesn't struggle to drink enough.
I should maybe push the water a little more, but
okay. Yeah. Okay, that's good. How are his sleeping habits right now? Does he take naps during the day, then sleep okay throughout the night?
So he's still taking an afternoon nap every once in a while. Maybe more often than not. It just depends on if he's tired enough.
Mm-hmm.
It takes a couple of hours in the afternoon. And that does push his bedtime back a little bit, but he's normally in bed around like 8:30 and sleeps till about 7.
Okay.
So,
that's good.
Yeah. And he's always been a good sleeper. He was always like 7 to 7.
Okay, even as a baby?
Yeah.
He was really good. Okay. Yeah. Good. I know you already told me he's pretty athletic, but does he seem to have like any exercise intolerance as a kid or anything? Like he doesn't seem too out of breath, no wheezing, nothing like that?
Yeah, no.
Okay. Even with the
he runs around. Even when he was little baby, he would lay on his back and like run a mile is what we called it, by like moving his legs.
Yeah. Oh man. So just some questions about like home safety and your neighborhood. I know he doesn't go to preschool just yet or anything. Okay. Good, but like he interacts well with the neighbors. He doesn't really have any problems.
Best friends.
Oh yeah.
The neighbors. He loves them so much.
You don't have any concerns about like other kids bullying him or anything like that?
No.
Okay. Good. Does he react okay to discipline? I mean, obviously he's 3, so it's not, super like second nature to him yet. He's obviously going to be a little bit like uncomfortable with it, but does he ever seem to like lash out and just not let things go? Or does he react to discipline as you would expect a normal 3-year-old to do?
I would say normal.
Yeah. Okay. All right.
I've never been asked that before.
All right, so I'm just going to kind of ask you questions about your family history, just to see, if Jackson has any risks for anything like that, or David has any risks for anything like that. So, are there any genetic disorders, learning disabilities, like autism in your family? No? Okay. Do you guys have any heart disease on either side of the family? Okay. Cancer, epilepsy?
Like my grandparents, but they're, in their late 80s now. So that's kind of to be expected, but not earlier than that.
Okay.
No epilepsy.
Okay. Good. What about arthritis? Obviously, this really isn't something you have to worry about with Jackson yet. But no. Okay. Mental illness or alcoholism? No. Okay. All right. So just some more social history of the family and the child that I'm going to ask you about now. The current county where you guys reside in this city, do you feel like it's safe, your neighborhood that you live in right now?
Where we live right now.
Yeah. Okay.
Yeah. I do let him play outside.
Mm-hmm.
And he's, has a blast digging in the dirt. And So.
Yeah, that's good. Do you feel like you're supported by family and friends when you're in this area?
Yeah. Our neighbors are so great.
Yeah.
Yeah. We don't actually have any immediate family in Pittsburgh, but we have lots of friends that feel like family. So.
Okay.
Yeah.
Okay. Good. What do you and your husband do?
So I'm a stay-at-home mom, and I also run my own business through doTERRA. I'm a doTERRA wellness advocate.
Okay.
And my husband is a research scientist for the University of Pittsburgh.
Okay. Cool. So you guys both have your PhDs, or?
Yep.
Okay.
Yeah, we met in grad school at Pitt.
Okay.
So,
Nice.
yeah.
Nice. Do you guys have any religious or spiritual involvement? Are you guys involved in a church that you feel supported by?
Yeah, we attend a Presbyterian church that meets in Oakland, Pittsburgh.
Okay.
And, we love it.
Yeah.
So many good friends.
That's
so.
good. And David goes with you guys?
David comes with us, and my husband actually leads one of their small groups.
Okay.
So,
good.
Yep.
So David gets to interact with those kids usually, too.
Yeah.
That's good. That's good. Let me see. All right. So I'm just going to kind of go through, it's called a review of systems. I'm just going to kind of go like a mini head-to-toe assessment, just ask you questions about each system of David's, and just let me know if any of these things that I bring up a point of concern for you. Okay? So I know you kind of told me overall he seems to be very well adjusted. He's developing normally. As far as his skin goes, have you ever noticed, like, does he seem to have eczema at a certain time of year? Does he have any, like, bumps, lumps, moles that are, like,
so the back
concerning?
of his arms, like here, they get a little bumpy, dry, and then also he has a couple patches of eczema that pop up from time to time behind each knee when I've been lazy about maintenance or giving his skin some added moisture.
Okay.
So,
So
but the doctor, like, I think around 18 months, like, did prescribe some hydrocortisone for those patches.
Oh, okay.
But now we just use a combination of essential oils.
Yeah.
And it takes them away in one day. So,
Oh, okay.
if it pops up. So, it's really effective.
Good.
Yeah.
I'm glad that you found something that works for him. As far as his neurological status goes, I know you've told me he's had no seizures ever. Does he ever seem to have, like, a headache? Has he ever hit his head? That you know, aside from, like, the normal.
Yeah,
you know.
he's 3 and he's
I was gonna say, I'm sure he hits his head quite often.
No, nothing going on like that.
Okay.
I would say anytime he's acting out of the ordinary, there's definitely a cause, like he skipped his nap or he's been sick or has a cold or there's always, I've never had behavior that's unexplained from him.
Okay, gotcha. As far as his eyes go, I know you said he's had, like, his normal vision checks as far as child vision checks go. He doesn't have to wear glasses.
No, not yet.
Okay.
There's kind of poor vision on my side of the family.
Okay.
Like, I wear contacts. My dad has very poor vision. It's managed completely through contacts, but so I'm going to keep an eye on that as time goes forward.
Okay. Gotcha. That's good. He doesn't seem to have, like, a light sensitivity, excessive tearing of his eyes. Okay. As far as his ears go, I know you said his hearing is pretty normal. Has he ever had an ear infection?
Once maybe.
Okay.
Yeah, I think around 18 months. Maybe not. Yeah, if once, if any.
Okay.
So.
Yeah, and it hasn't been, like, a chronic problem.
No.
You don't normally notice, like, ear pain or discharge, anything like that. Okay, good. Does his sense of smell, this is obviously really hard to tell with kids, but I guess, have you noticed, like, any abnormalities with his nose? Like, I'm sure kids normally get colds and stuff like that. Does he ever seem to have, like, excessive nasal drainage or just always seem to be sniffing or anything like that? Yeah. Okay, that's good. He still has his tonsils. I assume he didn't have tonsillitis or anything. Have you noticed any, like, gum bleeding, ulcers, sores in his mouth?
No.
Okay. No throat problems either. Doesn't complain of a sore throat. No hoarseness in his voice. Okay. All right. Does the range of motion in his neck seem to be pretty normal for a kid? Yeah. Yeah. So does he frequently get colds? I know it's normal for kids. No, he really never has.
Yeah, he's had a cough right now, actually, for about 3 weeks, but it's kind of fading away. We took him to the pediatrician, but they just said it was viral, nothing they could do. And I kind of knew that, but I just wanted to make sure. Did they listen to his chest and everything? No wheezing, nothing was going on. So,
Okay.
Yeah.
Okay. They just sent him home, and it's kind of self-limited.
Waste of my copay dollars.
Yeah. Okay, that's good. So he's never been told that he had, they never told you he had a heart murmur when he was born. He wasn't blue or anything like that. Have you noticed continuous squatting? Sometimes kids can do this when they feel extra short of breath or anything.
No.
No.
He is never short of breath. He just goes and goes and goes and goes. Yeah.
Yeah, that's good. And he does he sleep in the knee chest position? Or is he pretty sprawled out?
He's sprawled,
Okay. That's good. So you said, kind of answered this already, but his appetite's been pretty good as far as a 3-year-old. Okay. He's never had problems with nausea, vomiting, diarrhea.
No, he's actually never thrown up.
Really?
Yeah.
Good.
Neither of my kids have. I know. Right? Next week they'll be like vomiting here. Yeah, no, I've never had to deal with throw up as a parent yet. So
Okay.
I know it's coming. But
Yeah, eventually probably, but that's great so far. No constipation or rectal bleeding either.
No.
Okay, good. So I know you told me he's already potty trained pretty much, which is awesome. He's never really seemed to struggle with frequency, urgency. I think it's kind of hard to tell right now. Like when they tell you they have to go. But
yeah, no, he can. I mean, if we're driving, he says, "Mom, I have to pee," he can hold it till we get home.
Oh, okay,
So,
that's good.
Yeah,
That's good. Okay. He's never broken a bone, no sprains. You don't notice any joint inflammation or anything.
No.
Okay.
I know that's coming too with a boy, but
Yeah. Does he ever seem like, this is obviously it's still hard to kind of tell when he's 3 years old, but does he ever seem like excessively nervous or anxious?
So he does pick his nails.
Okay.
And so we've been trying to figure out, like, I think it's anxiety driven. Like sometimes it's like before he goes to bed or when he's reading a book or just like it's just a nervous habit. So just trying to figure out what's going on with that.
Okay. Does it seem to like arise more in social situations?
Yeah, and like for a while, like especially when he was meeting people he didn't know, he would like have his like hands in his mouth or fingers in his mouth. And I think I was told that toddlers can kind of do that. Yeah,
and for his age, I'm sure that's fairly normal. But it's good.
I also pick my nails, so my husband's like, whenever you stop picking your nails, David will stop picking his nails. So, yeah.
Well, it's good that you're at least aware of it. Yeah. So for his endocrine system, does he seem to have like normal hair distribution on his head?
Yeah, I mean it's a little thinner up top, but we keep asking the pediatrician, and she's not concerned at all.
Okay,
so
that's good.
Yeah,
that's good. His skin doesn't seem, obviously this time of year everyone's skin is getting kind of dry, but his doesn't seem like excessively dry or.
No, I mean when he was little, we definitely I didn't use. They tell you not to put any lotion on babies, right? So I wasn't using anything until like he was a year. And at around a year, they said start using something just for daily maintenance. Okay. So we still do that.
Yeah, that's good. Do you have any concerns about his weight? He's always been pretty normal.
50th percentile.
Oh, perfect.
Everything, yeah.
Yeah. There's been no recent weight changes or anything like that. Okay, good. And lastly, have you ever noticed any abnormal bleeding or bruising on him? Like obviously, if he smacks his leg, he's gonna have a bruise.
Yeah, he has bruises on his shins right now because he runs into stuff and he's riding his bike and his scooter around the house all the time. But I'll keep an eye out for that. But not really.
But nothing like seems to appear just out of nowhere.
Yeah.
Okay, good. Do you have any additional concerns about David that we didn't talk about? Sounds like you've really kept up to date with all of his health maintenance things and everything, that you guys are taking good care of him. So
no concerns, just dealing with normal 3-year-old stuff.
Okay, sounds good. Well, thank you so much for letting me conduct the interview, Julie. Really appreciate it. So.
No problem.